Hi, Ipshita. Hi, Shitangshu.
Hello.
Hi.
Welcome to another topic. And this is something as important as education, maybe, or perhaps more.
Okay.
Can't debate that. Healthcare.
Mm-hmm.
And yes,
Oh,
and this is something that affects all of us, all our lives. Um,
yeah.
and um I'm waiting to hear your story and your take on what Canada's healthcare system is like. Uh, I'm just going to give you a context of what it
Mm-hmm.
is. So, of the 30 countries with universal insurance coverage, Canada
Mm-hmm.
ranked as the highest spender of healthcare as a share of its economy, which is 13.3%, which is huge, and eighth highest on a per person basis. And of course, that will vary
Wow.
according to the age, but this is the figure in numbers. However, despite the spending, Canada's performance is almost poor. So,
Yeah.
Yeah.
is there a reason? Do we have a story? Do we have like lived experiences to share? Uh, I will perhaps go to both of you for this. So I was just doing a bit of my research
Mm-hmm.
and trying to see that in general, whenever we kind of congregate, it is always negative. It's like, oh my God, there's so much wait time. Oh my God, the doctor didn't see us. So I was like, is it really so? And let me find out. So most articles, I wasn't really shocked because most articles nowadays claim that if Canada healthcare was a patient, it would have been in the ICU. So,
I'm not
so,
surprised.
Yes.
so a wonderful article by David Jones in the Globe and Mail talks about the
Yeah.
healthcare crisis and which is looming large. So I just want to know, do you agree with that? Though OECD, which is an Organization for Economic Cooperation and Development, report
Mm-hmm.
card is okay. It's not really bad. So, but here are two people who've had varied experiences and had their run-ins with the healthcare. So, who goes first? Ipshita or Sitangshu?
Let's go alphabetically, I guess. So Ipshita, E for Ipshita. So
Me
Okay, so tell us
first.
your view and your lived experience.
Absolutely, absolutely. Thank you
Yeah.
so much for having me on today. So there's a lot, as you said, when we all congregate, there is so much negativity to talk about, to discuss. So let's start with some of them. So, as you said, we are definitely, Canada is definitely on, at the top when it comes to spending the most, under the whole OECD congregation. And yes, that is definitely the case. And you must have read about this as well, that the life expectancy of people in Canada, that has increased overall in the past few years. In fact, we are also considered as one of the most healthiest people amongst all the other countries. Yes, those are some positive aspects to it. But at the same time, although Canada spends the most, we are the healthiest country, but in reality, we are the least affordable and least accessible. We have the least accessible healthcare system. I'm sure this is something all of you can agree on.
Yes,
Right?
absolutely.
Yeah. And the main thing is, if you're sick, do you go to the emergency? Do you go to a walk-in, or do you just call your family physician? Either way, there is a wait, and either way, you know that you will be turned down from getting that antibiotic. You will be turned down from getting that blood test unless and until you're on the verge of death.
So, did
100%.
you face something? Did you face something personally? Tell us that.
Yes. So personally, it's one of my family members who was ill. This was initially when I came into the country, just my first year in the country. It was the first summer. We were excited because, those are the only 2 months we wait for. And at that point, my husband, somehow he started experiencing a lot of backache, lower backache. Uh, you know, being a science student, and again, as Indians, I'm sure most of us can self-diagnose. We know what's going on with our body just by understanding, where is the pain point. So at first we thought it was something to do with, irritable bowel movement or indigestion. But then at some point, it was, the pain was excruciating. He could not handle the pain. And we stay right opposite one of the biggest hospitals, which is Trillium in Ontario. So it's just bang opposite where I stay. So we crossed the road, we walked over there. It was the first time going into an emergency. Yes, we waited 7 hours. We went there at what? I believe at around 10 or 11 in the night. And it was early, like wee hours in the morning. That's when somebody actually attended to him. So, and all they did was they said, oh, you have some issue with your bowel movement. So here you go, some drugs to, take care of, whether it's, I believe they thought it must have been due to gas. And they just let him go. So that's it. We came back home. However, it did not help. Another week passed and the pain persisted. And at this point, this was the second time we walked into the ER. And at that time, I had a feeling that something is wrong because he mentioned of a great pain at, during, I'll tell you where it was, at the lower back. And the place that he pointed out, I had a feeling that it has got something to do with kidney. Again, the novice pharmacist or doctor in us somehow, that's how he knew that there was something wrong with the kidney.
Common sense kicks in, right?
Common sense kicks in, exactly. And then again we go back. The same questions. Do you have a family history of kidney issues? Do you have this? Do you have that? And no, none of those. Anyway, yet again, they thought this had got something to do with his intestines, and they gave him an enema. Yes. Okay. And again, that didn't work. Finally, they did an MRI, and that's when they found out that, yes, there were stones.
Oh my God.
It took almost 2 weeks for the doctors to realize that, no, this was not some irritable bowel movement or something to do with gas-related pain. It was an actual kidney issue, which was kidney stones. Fine. That being said, he was admitted. And he got a good bed, because that's again another thing that's for another day, I'm sure. Finding a good a bed for you to actually lie down on, because I've seen people who were about to be operated, but they were not assigned a room. They were on designated beds, but that was in the corridor. I'm sure we must have all seen this scene in some government hospitals back in our home country, but you would not have expected that here. Yes, we did go through that, and most of these people were by themselves. They did not have family. They were just cribbing in pain, and they were there. They were lying there. Anyway, we were told that he would be operated. We waited. After almost 6 hours, the doctor came, said that, okay, this is the mode of action we are going to take. This is the type of operation we would be doing, and it'll be done. It's not going to be more than a 1 hour long operation. You won't believe it took us almost 7 days till that operation was done, because they just let him be. He got admitted. It was a Thursday night. Friday, Saturday, Sunday, I'm sure the doctors were busy in their own personal lives.
He was lying there.
Yes. They came in, they said that, okay, tomorrow is going to be the operation. So they asked him not to have any water, no food, because, that's how it is. Before you get operated, you're not allowed to. Exactly. So every day they came in and they said that, okay, tonight is the operation, or tomorrow morning is the operation. He did not have food for almost 5 days, barely any water. And he was on morphine. So you can say that he was almost in a a drugged stage. He didn't know what was going on. He lost a lot of weight at that point, and it was so mentally exhausting because I could not tell our family back at home because they would worry. But
That's
I'm sure they had a
terrible.
feeling that there was something wrong.
Oh my God.
And then finally,
I just don't have anything to say. I mean,
yeah,
this
and
is
then
too
finally,
much.
and there was so much more drama to it. Again, I'm not going to go more in detail. I actually took him out. I said, you know what, he's not going to be there for as long as this, because at that point, we had just come into the country. As I said, we were being paid on daily wages, so that's how it was. So we miss a day, we do not get paid. Imagine 2 weeks of not going to work. It started
Absolutely.
taking a toll on us. Yeah, it started taking a toll on us financially, mentally for sure, physically, of course. Let's not even get there. And somehow finally the operation was done, but that too, it was not a straightforward way that, okay, tomorrow is the operation. I had to take him out. And another thing is, you cannot visit the specialists here. You have to wait for months to get a referral to go into a specialist's place. So somehow I got in, and they said, no, we cannot do that. He will have to wait for another week. I said, we can't do that. This person has not eaten in the last week. So anyway, they gave us a date, and you won't believe it, just took 40 minutes to get that operation done. He walked out of the hospital himself after the operation. However, we had to suffer for more than 2 weeks, not just physically, financially, as well as mentally. So this was the experience in
No
a gist
words.
that that
No
we went through,
words.
and that too in the first year.
It's terrible and it's scary. It's
Yeah.
just terrible and it's scary. Um, Sitangshu, your story.
I'm just, I'm just thinking. I'm like, oh my God, like
Are
I
you
really
still
can't.
wrapping your head
Yeah,
around this?
I am. I mean, I have personally lived such experiences, and I have seen my friends go through these experiences. I've accompanied my friends. So, every time I witness such a thing or hear such a story, it feels surreal. You know why? Because um, you pay a lot out of your pocket in terms of taxes
Correct.
for a first world country, for a universal healthcare system, and this is what you get. So, but and you know what, in running, like, the OECD who made the report card, they should stand in line in the hospital for a change. Then let's see what the report card says.
Yes. See, there are, yeah. But before even I go there, I know that you recently visited the hospital for a salmonella outbreak. And this is something that I've only read in newspapers before it actually hit home. So, tell us your experience.
uh, um, well, let's just say I was at a birthday party, and there I had some nice Indian food. Uh, this was on a Saturday, and the symptoms started showing on Sunday. I mean, like, I'm talking like till a good 24 hours, I was all right. And I did not know this salmonella bacteria was going to wreak havoc on me in the next 24 hours. So happily, I drove home. I had a nice dinner, rather than early dinner on Sunday, and then I came home. And that's it. I felt very dizzy. I was like, oh, maybe I'm feeling sleepy because of a nice meal. I slept, and then that's it. I slept, and again I woke up around say 12 o'clock at night, and that's it. I had a very bad bowel movement. I had like I puking and stuff like that was happening. Things coming out from where they shouldn't. But then again, anyways, so that was terrible. Now, fast forward to a few days. My friends and my uncle, they came to my help, and so let's just say this was on Tuesday. Yeah. So now, just like Ipshita, even that this Indian medical common sense kicked in that, okay, maybe I can resolve it on my own rather than going to a hospital ER or to a walking clinic. Because again, like Ipshita, even I had experiences where they, once you go there, they don't take you seriously. So I was like, okay, maybe I can resolve this thing on my own. So, but nevertheless, my uncle took me to a walk-in clinic, and I explained the situation to doctor. My uncle was also there supporting me, and this lady was like, "Oh, you know what? The first thing she said was, oh, in Canada we do not have bacterias at all." I'm like, okay. So like, you know what? This is completely viral, and there are no medicines for viral. But however, I would recommend you to take, off-the-counter medicine, and you should be all right within a few days. And if you're not all right, say maybe by another 2 3 days, come back and pay a visit to me. The first sentence that there's no bacteria in Canada, I was like, okay, she's a doctor. I listened to her. Hey, I'm not a doctor, I'm an engineer. So what do I know? But nevertheless, few hours later that night, I am curling up on the floor like, oh my God, this is like unbearable. 6 o'clock in the morning, my uncle sees me curling on the floor, like, what happened? Like, I mean, I cannot take it anymore. That doctor was a fake doctor. We are not visiting her anymore. Like, okay, let's visit the Oakville Trafalgar Hospital, which was very near. And we walked into the ER. Now, surprisingly, my wait time was not that much. This is probably because I visited early in the morning, maybe around, I think, 8 o'clock. So instead of visiting my office, I visited the ER, correct, 8 o'clock in the morning, and there I was all registered in, and then started the wait time. So good thing is the nurses came, they did the basic registration. One thing I found out that Canadian hospitals, they pay a lot of emphasis on the administrative work. Uh, and we have a something, we, of course, you guys know, we have something called as a health card. But then guess what? The health card is only a number which never shows the historical patient records. It never shows, it's never connected. So, nevertheless, the nurse asked all the basic questions. I answered them. What all happened? Gave the entire history. And still the pain is ongoing. Then they suggested a few tests. Now, after I think a good 2 or 3 hours, the doctor came and she was like, hey, you know what? I have asked you to go through a few tests. I'm pretty sure the nurse has also briefed you. I did all the tests, which included an MRI and, let's just say, all sorts of, bowel movement related tests were there. And now here at this point of time, I am expecting that, I will get a painkiller or some sort of medicine to assuage this pain. But again, kind of 4.5 hours into it, still nothing. Still there, I'm lying down in the hospital wearing the skimpy hospital gown. Now, finally, this, I think after the doctors, she's like, okay, you know what? Okay, you are done with the test. I'm like, yeah. So I believe some of the other members who were there in the party, they also came in to the same hospital, and the doctor kind of realized that there is a set pattern to it. So she had involved the Halton Healthcare, and she was like, you know what, this needs to go to Halton Healthcare. There needs to be a proper investigation for this restaurant. But then still, no medicine on site. And then finally, maybe after close to 6 hours, she's like, you know what, let's get you the drips. So then easily the drips were there, and then finally, after 6.5 hours, they injected some sort of painkiller into my body, after which the pain subsided finally. So that's like after 4 days, the pain finally went off. And then finally, I called up Halton Healthcare to know whether, what is going on. So like, okay, salmonella. So that was there for me, and I was like, okay, I didn't know this is going to be that bad, but
So you didn't go back to the
it,
doctor to tell her that.
I was just about to ask the same.
Oh
I
my God.
really, I I don't want to take her name, but then let's just say it's a walking clinic in Burlington. So to the viewers who are listening, please be careful. Very simple as that. And you know what? This is not just an experience with just one walking clinic.
Yes, yes.
Back back when I was here in, I'm talking in 2021. Even then, also same thing.
I would echo that.
The
Yeah.
walk-in doctors,
Hmm.
I don't know, for some reason, they really don't take the patient seriously. They think that, as if the patient is doing drama. I mean, that's the
Yes.
kind of a very casual attitude. And I mean, hey, I'm not begging for empathy, but then that's the least that you can show and have
No,
that
I
concern.
I completely echo that sentiment. I've had a terrible experience as well here in Erin Mills in one of the walk-in clinics. My 1.5-year-old, she had almost 104 fever, and it was perhaps the second day, and it wasn't subsiding. I took her. And she was getting listless. So I immediately took her to this walk-in clinic, and I was pretty new to this area as well, so I didn't have a family physician here. So I went there, and she made me wait for some time, and then she went inside, and then she came back saying that you can have a call with the doctor. I said, look, I don't want a call with the doctor because this happens to be my 1.5-year-old, and she's very, very little, and I want you to check her, check her chest, and see her chest, see her eyes, everything. That's why I've got her here, and she's in the clinic, so if you can please request the doctor to kind of see her like for 2 minutes. And she flatly denied, and I couldn't see so many patients. Had it been completely full, I would have understood that they are overworked, so therefore the doctor can't see any more patient. But it was an empty clinic with just like 2 to 3 patients there. So I don't know if it was already booked, or I don't know what how it functions. But I was really angry, sad, upset, everything together, because here it was for a 1.5-year-old. Had it been for me, I would have taken it. But for a small child who I've dragged all the way in this sort of a fever just so that a doctor sees her. And even when I'm inside the clinic, the doctor denies that. I'm like, have you not taken the oath? Isn't that a basic thing that the doctors ought to
Absolutely.
do when a
Mhm.
patient is at the door, that you're supposed to see the patient? And well, it didn't happen. I had to run again to another clinic. And so yeah, and I did write a review for that particular walk-in. But I think this is a general thing about walk-ins. They do write walk-ins, but they don't want to see patients. Or I don't know how it works, but it's pretty depressing. But however, I have to say that I've had my second pregnancy here, and that was really smooth sailing. Very,
Okay.
very smooth sailing, and a very pleasant experience. So I'm sort of on the fence. I don't know. I don't know exactly. Uh, you know, because yes, I've had quite a few bad experiences, but I've also had a few good experiences. So yeah, I'm on the fence. But let's quickly go to the next one. What, according to both of you, as a
Mhm.
resident of Canada, what, according to you, really worries you about the healthcare? If you could point out three things, three pain points.
You want to go ahead, Ishita, first?
Yeah, so
Yeah.
something that I always think about, as you said, in the future, when I have kids, that would be my first priority, because moving to Canada, this was one of the main reasons, one of the main USPs of why Canada. Many people ask me why Canada. This was definitely part of the top three reasons for moving here. That is the free health system. But as we know, in reality, is it really free? And if so, at what cost? Again, accessibility, affordability. And when I think about my family in the future, as you just mentioned, that a 1.5 year old who's cribbing in pain, who has 104 fever, and they just don't want to see the child. So I would say that really worries me a lot. And recently, I'm sure you must have read about some children getting a multi-drug resistant streptococcal infection. And due to the lack of, because they feel that, oh, it's just a fever, it'll go away, we will not prescribe any antibiotics, we won't say it's just a fever, let it go. A child actually passed in Whitby. And when I read that, my heart was, my heart wrenched. It was, that's something that every parent dreads. So why this lack of care? That's what you're here for. That's what the whole facility, the care system is for. Then why is there a lack of care, especially for children? So that is something that really worries me. I don't mind paying taxes and more funds going towards building a better healthcare system, sure, but at least let us all equally have access to it. If there are more immigrants coming in, we might as well have more doctors available, and not just book patients over the phone, because that really doesn't do justice to us, and obviously to the healthcare as well. So
Absolutely.
It doesn't make sense. So that is what I really dread.
Yes,
For
absolutely.
me, of course, I haven't gone. Of course, I mean, I'm not married. I don't have the responsibility of children at this point. But then again, um, if I'm experiencing such a thing, and I fast forward a few years, if this is what I'm experiencing, I really don't want to experience this kind of thing for my kids or my would-be kids, whatever. Okay. So I really hope that these so-called wait times, the other day I was looking at the CBC News, and they reported that the average ER wait time in a hospital is 20 hours, 18 to 20 hours. The chief of medical association herself is saying it's 18 to 20 hours. So just imagine on the on-ground reality is going to be, it's not hard to even extrapolate on that. My another second major worry is, and I think I pointed out earlier while talking, there is no centralized system. There are a lot of, they pay a lot of emphasis on making notes, reporting things accurately. But guess what? I go to one clinic in Mississauga, another clinic, say on the east end of Etobicoke, and probably I have another doctor in Brampton. None of them are connected. Either of the doctor doesn't know what my medical history is. So there is no centralized health record. So there are a lot of administrative inefficiencies, I would say, and there's no data sharing. So I really hope that if there's a centralized data sharing system, I think that would make everyone's life easier. And not only just that, you know what? When I had a leg injury, I had to go to Brampton for my physiotherapy because that was apparently recommended by WSIB. But then again, my doctor wasn't at Etobicoke. So you see the distance, and back then I didn't even have a car. So distance was there, but then again, on a positive side, they said that, hey, you know what? We don't mind compensating you for it. So okay, you're good to take a cab and and move around. So that was a positive side, but then again, to diagnose whether they want to operate my knee or they want to go for a physiotherapy, that itself took them anywhere between 2 to 3 months as a decision. Parallelly, I went to a walking clinic here in Etobicoke. For 1 week, this doctor didn't take me seriously. Second week, again, I came back. He's like, "Oh, you're still complaining about it. Oh, so don't worry. I will refer you to a specialist." And the specialist appointment was a WhatsApp call. And to be honest, I don't want such sort of remote service. I personally would like to have a personalized attention. I mean, I have seen no doctor, viewing my knee bone structure from a pigeonhole camera and assessing the damage. I really would like to have.
Absolutely.
I
It
really would like
sounds
to
only
have a.
funny.
It's
I can't
absurd.
help but laugh.
It's exactly. It's
Yeah.
absurd. I would really like to have a proper doctor, do your X-rays, do your MRIs, and tell me where things have gone wrong,
Absolutely.
right? So that is my third point, that please give me a real care. I don't
So-
mind paying for it.
So
I don't mind paying
basically,
for it.
I don't know exactly whether this universal healthcare system is working for Canada or not. Because, because this healthcare system is trying to make make healthcare available to everybody, what's happening is that obviously they're leaving many gaps. And also, because they're trying to have so many people, they're trying to accommodate so many people within that particular resource. What's happening is they're cutting down on technological advancements, which is very, very vital, and also perhaps, like this, they're not hiring as many doctors, as many healthcare professionals as needed. So they're cutting down on many things to make it accessible to as many. So it is really very basic. So, anything which needs a little more attention, that has a severe wait time. And also, I think, because there's so much of administrative work that family physicians are complaining of, what's happening is their attention is only going to the administrative work, and therefore their capacity to see patients is obviously going much lower than it should be. So they should look at AI. They should look at how technology can take over uh, this paperwork,
The redundant tasks,
and
I'm guessing.
perhaps
Yeah.
doctors can just see patients and can completely devote their attention to patients and their care. So a lot of things can be done because there is an aging population that needs that attention. There are young people, there are many immigrants coming in, so there is that much more burden on the already existing burdened healthcare. So we dread to think what's coming our way in the near future. But I am sure someone who is making the policies are looking into it, as seriously as we are debating this and discussing this. And I hopefully they find some way out for us.
Absolutely.
Thank you so much. Thank you so much for coming in. Thank you so much for sharing what you shared. And fingers crossed, we'll have better days in the future. Better
I
healthcare in
hope
the
so.
future.
Looking forward to it. Yes.
Absolutely. I really don't mind, praising the universal healthcare system and calling, hey, come to Canada. This is not working. Okay, thank you for having me.
Thank you. Thank you. Good night.
Thank you. Good night.